Lots of Pennsylvanians dropped their health coverage earlier this year as premiums soared. Tonight, more bad news. Seth Kaplan is back with us. Seth.
Yeah, Alicia, not a shock, but something leaders hoped to avoid. Turns out it was one thing to sign up for coverage, another thing entirely to actually be able to pay the much higher monthly bills.
More and more Pennsylvanians are making the difficult decision to drop that coverage.
Even now, in the middle of the year, Penny Executive Director Devin Trolley confirming Pennsylvania is not immune to something reported in Thursday morning's Wall Street Journal. Americans everywhere losing coverage mid-year because they can't pay their insurance premiums.
And that's a result of there being fewer federal tax credits available.
Congressional Democrats wanted to extend COVID-era subsidies, which lowered premiums and resulted in the highest ever percentage of Americans being covered in 2025. A trend that reversed during open enrollment this year and has continued. After 85,000 Pennsylvanians didn't renew their policies, another 45,000 lost coverage by early April because they couldn't pay the big bills. Two mid-state counties, Juniata and Fulton, facing the biggest increases in the state. That 485% increase in Juniata County compared to a doubling on average across the Commonwealth. Mifflin County tied with Schuylkill for the highest percentage of people losing coverage.
And what we certainly hear from people every day is that, there's less and less room to shift things around.
Certain kinds of people have lost coverage at particularly high rates.
Are those who have incomes above $63,000 because they went from getting some tax credits to getting no tax credits, and in some cases now paying thousands of dollars a month for coverage.
Also, people between 55 and 64 years old.
Almost Medicare age, but not quite 65. So they are just looking for something to bridge the gap. They have healthcare needs that need to be addressed. So that is a really big group that we see impacted by these higher costs.
Republicans said the $82 billion in subsidies to keep premiums low were too expensive. But Trolley says the lack of them is expensive too.
We often hear from small business owners who are making really difficult trade-offs between putting more money in their health insurance versus putting that money in their business and trying to grow their small business, hire new employees.
Devin Trolley told me Penny is doing what it can to help people identify affordable alternatives. But in the end, the big money came from Washington, and any big solutions, Dennis, would have to come from there too.
Hi, I'm Eric Finkenbinder from ABC 27. We're excited to announce the new ABC 27 News Plus app. Live stream newscasts or watch content on demand. This is different than the ABC 27 app on your smartphone. You can check this out at home, and it's very easy to use. With a Fire Stick, go to the homepage, scroll down to search. From there, enter ABC 27. Move over to the apps, and there we are. Click the icon and install. It's just that easy.